Okay, medical update here on SMX Insider. We bring in Dr. Joe McGinley from the McGinley Clinic. A couple riders getting back, trying to chart their progress. First, let's talk Cooper Webb, the Monster Energy Supercross champ, but meniscus surgery on the knee. Now, I'm smart enough, not a doctor, to know that ACL surgery, much more intense than that. How bad is recovering from meniscus?
Well, it's great seeing these guys coming back for the playoff rounds. It'll be exciting to see Cooper Webb back at the starting line. For this type of injury, you're absolutely right. An ACL, that's a major injury of the knee, requires a surgical procedure, a lot of downtime. With a meniscus, similar to Cooper Webb's injury, he was able to go in surgically. They went in, they cleaned it up, and they put a couple stitches in to stabilize it. So that's more on the minor side as far as injuries within the knee. I'm sure they used a scope procedure, so not a big incision, not a big area that had to heal. As far as affecting his race rounds, I really don't see much of an impact from the injury or surgery itself.
So we're looking at some other riders coming back for Charlotte. Max Anstey being one who has been out since Birmingham with this fibula injury, but he suffered the same injury in theory as Eli Tomac. Their recovery process and I guess their decision making to get back to racing were very different. Where Eli Tomac underwent a procedure, Max Anstey did not. What goes into something like that as far as the decision making process from your expertise? What would make you want to go for either direction of those decisions?
Well, JT, it depends how much time we have to talk about this. So this is the art of medicine is what you're getting into. There's no two injuries that are exactly the same. There's no two doctors that are going to give you the same exact recommendation. And we're always right. So whoever you ask, yes, we're right. Taking that out of it, though, the fibula in the leg, that's the smaller bone in the lower leg. So you have the tibia, which is the main weight-bearing bone, and then the smaller bone next to it on the outside is the fibula. For the upper part of the leg, the fibula doesn't have a significant load-bearing structure. So a lot of that's being taken by the tibia. However, at the ankle, the fibula helps with stabilization of the ankle joint. So the tibia and fibula come together and sort of create like a glove around the ankle bone. That's more significant. So if you have a lower injury, that's where you can get instability. You can get ligaments injured in the ankle. If you have a simple fracture in the mid to upper part of the leg involving the fibula, sometimes that doesn't need surgery. So it depends where the fracture is at. It depends also on the sport and the timeline. If you're going to be racing motocross and you want to get back on the bike, that's a lot of impact on that bone. So you'll have what's called micromotion, and that can impair or impede the healing of the bone in the leg. So for Max Anstey, they may have looked at it initially, thought it was a simple fracture, maybe in a non-weight bearing area, thought it was going to heal. And then as he pushed it along, that fracture didn't heal as expected and then unfortunately required surgery. So yeah, those things are not straightforward. It's not a yes or no. It depends where it's at and how it's going to affect the rider in their particular sport.
All right, well, it worked for Tomac. He was back and fast immediately in pro motocross. Anstey, still a question mark for this weekend, but just good to have these riders back. And hopefully we'll have fewer things to ask you about with injuries next week when we get another update.
Thank you. It's always fun to have these return to riding updates. Those are the best ones.